going to talk about a very valuable experience I had on a flight dealing with an emergency situation and saving a life of a young 40-year-old mother of 1-year-old.
I was on my way to Pennsylvania to greet my wife and kids to be faced with a life-threatening emergency. And this happened almost at the same time.
And it's kind of unusual that one place with two physicians had experience in short time. You don't see it very often.
And you think, well, how common is that to happen? It's extremely, extremely rare.
I'm Ankit Patel. I'm an interventional cardiologist with Heartbeat Clinic, and I work at Cartersville Medical Center.
My name is Dr. Carlo Oger. I'm an emergency physician and the medical director at Cartersville Medical Center. This is our story.
The culture of care is pretty simple. It's a small town. Everyone are friends and family. Patients know each other. We are on cell phone basis with physicians, and mostly are like-minded, practitioners here. They all are family people, giving, very active in community events.
You hear stories of staff members who got involved with patients and helped pass their duties in the emergency department.
So this was a family vacation going back to India. Last 2 hours, we were waking up, getting ready to land. And then I saw an air flight attendant running to a lady which was 3 seats ahead of me with an oxygen tank. I volunteered myself and went back and checked out. And there was this lady who was about 40-year-old. And when I assessed the lady, she was not opening up her eyes despite me giving painful stimuli, yelling. She was looking pale, ashen, sweaty. The only thing I heard from the family before she passed out, she was having chest pain and leg pain. So I was concerned that she could have a heart attack or blood clot. Her pulse was getting weaker. I couldn't feel her pulse at all at one point. I asked the flight attendant and the captain to make an emergency landing. They ended up landing the plane in Doha, Qatar. And then eventually she was awake when the flight landed. She was still hurting in the chest, and local EMS took him to a local hospital. She made it.
I was on my way to Pennsylvania to greet my wife and kids, and we were already on the plane. It was a pretty packed plane. We were starting to back the plane out of the gate when they called for emergency assistance. Do they have a doctor on the plane? To my surprise, it was a patient that was very ill, and said, this is the real deal. We need to turn this plane around. We need to call an ambulance. And we pulled her out of her seat, laid her right in the middle of between the cockpit and the first few rows of the plane. Then somebody else showed up from the airplane, a nurse with ICU experience, started the CPR, actually doing compression of the patients. I'm at the airway doing the ventilations. We started doing that for about a minute when another flight attendant showed up with an AED, an automated external defibrillator. So we hooked it up to the patient, and to my surprise, the machine automatically looks up the rhythm and says, shock advised. And we go through 3 rounds of shocks by the AED. And when the paramedics showed up, they hook her up to the monitor. Sure enough, she's got a rhythm. At this point, she has a heartbeat. They start checking blood pressure. I go to the side to give report to the one paramedic. One of the flight attendants gets a family member on the phone. And to all of our surprise, the lady on the phone only spoke Spanish. I'm like, give me that phone. I'm originally from Puerto Rico, and I was born and raised there. So I was able to not only help the patient, but also the family member. I never did find out what happened to the patient.
So I think it comes with being a physician, that you want to help someone who is in need of a health problem. And so that's always in back of our mind.
Since I've been involved with Cartersville, we've done nothing but improve the care of the emergency department, improve the staff, improve the quality of the care that we're providing to our patients.
With God's blessings and hard work and support of the staff and family members, everything is going great, and we have built the cardiology program, still growing.
And this experience reboosts my love for emergency medicine altogether. My name is Dr. Carlo Oger.
I'm Ankit Patel. That was our story.